Hello, my name is Dr. Matthew McCauley, and I'm one of the cataract surgeons at Berkeley Eye Center. You are probably watching this video because either you or one of your loved ones has been told that they have a cataract. Before we meet, I would like to tell you about cataracts, how the surgery is performed, and some of the new exciting options you will have with your cataract surgery. We are humbled and grateful that you would partner with us in working to improve your vision through cataract surgery. A cataract means that the natural lens inside your eye has gotten cloudy. New glasses usually will not adequately improve the vision very much at this time, and often the best option is to perform surgery. In this surgery, we take out the natural lens and replace it with an artificial intraocular lens implant referred to as an IOL. The decision of when to do cataract surgery is an individual one. Usually, I recommend performing cataract surgery when your lifestyle is being impacted by the decreased vision. The most common symptoms of cataracts are blurred vision, difficulty reading road signs, especially at night, increased glare at night, decreased ability to see in low light, such as fog or rain, inability to read, or needing extra light in order to read. Our preoperative appointment will typically last 3 to 4 hours. During this appointment, you will have a complete eye exam and several other measurements of your eye. You will also have a chance to meet and discuss with me the problems you are having with your vision, as well as the different options available to you for correction of your vision. You will also see a counselor to review the instructions, prepare all the paperwork, and schedule the actual procedure. During your cataract surgery, we are replacing your natural lens with a new artificial intraocular implant. These lenses are designed to improve your vision, but many patients will still need glasses for most tasks. The lens covered by insurance companies works very well, but for most patients that will require them to wear glasses for distance, intermediate, and near tasks. It is important to know that it does not matter whether you wore glasses or not prior to this surgery. If you choose standard cataract surgery, you should expect to wear glasses full time. One of the most exciting recent innovations in eye surgery is the use of new technology and lenses that allows for patients to become less dependent on glasses after cataract surgery. Although these items are approved by both Medicare and insurances, they do not pay for them. However, they do allow for patients to choose to cover the additional fees themselves if they would like them. Because so many folks would like to have these options, I would like to take a few minutes to tell you about them. The first category of these new lenses and technologies are designed to help patients to see at a distance without glasses. At Berkeley Eye Center, we call this our custom package. This gives most people the ability to pass the driver's test without glasses. You will still need glasses for computer and for reading, but these can usually be purchased over the counter. This allows us to use additional technology to correct astigmatism you may have, choose the best possible lens type, and diagnose any conditions which need to be considered for your optimal vision after surgery. The second category of new lenses are the multifocal or enhanced depth of focus lenses. These lenses work by having different focal points, and they allow most patients to see at a distance and up close without the use of glasses. We call this our premium lens package. These are the most advanced lenses available and will give most patients freedom from glasses. As with any surgical procedure, there are risks with cataract surgery. While the vast majority of patients do extremely well, everyone who has a cataract or lens surgery has a small risk of bleeding, infection, inflammation, lens dislocation, dry eyes, or retinal tear detachment. On occasion, patients may need a second surgery because we are unable to completely remove all of the natural lens, or a new lens cannot be implanted as we would like inside the eye. In the future, you may also need a laser procedure called a YAG. Due to these risks, we typically do one eye at a time, 2 weeks apart, and ask that you come in to see us right away should you have any concerns about your eye or your vision after surgery. Thankfully, cataract surgery boasts one of the highest success rates of any surgery. I do surgery at our state-of-the-art outpatient surgery center here in the Woodlands area of North Houston. Most patients are at the surgical center for 2 to 4 hours on the day of surgery, and the surgery itself typically takes about 10 to 15 minutes. We use topical drops for anesthesia and a little medicine in the IV to keep you very relaxed. Most patients find the process to be quite comfortable. After surgery, most patients can go home within a few minutes. We will need to see you the next day in the office to check on the eye. During the first week after surgery, it is important not to put pressure on the eye or rub the eye. Most patients find they can return to their normal activities, including driving, within 1 to 2 days. I understand how important vision is to our patients, and we want to make the best decision with you and for you. Our goal at Berkeley Eye Center is for you to be satisfied with your choice of options, extremely pleased with your outcome, and we are here to help you in that process. I hope you found this video informative. I look forward to seeing you and working with you to give you the very best vision possible. I wanted to let you know that each patient is unique, and sometimes there are circumstances which require additional consideration. The first situation is in patients who are considered nearsighted. These are patients who can remove their glasses or contacts and see up close. The medical term for this is myopia. When we perform cataract surgery, we are resetting the focus point of the eye. If you choose standard or custom, we will typically set the eye's focus point for distance. The medical term for this is hyperopia or farsightedness. In this case, patients who are nearsighted will lose the ability to see up close without their glasses, and this can be an adjustment for patients. If you are nearsighted and would like to remain nearsighted, you will need to let us know so that we can discuss this option with you. The second situation is for patients who have had prior refractive eye surgery, such as LASIK, PRK, or RK. These procedures change the shape of the cornea, which is one of the measurements used to calculate the power of the new artificial lens implant that will be placed at the time of your cataract surgery. Patients who have had these prior surgeries have a higher chance of the calculations being off and therefore incorrectly predicting the power of the implant. What that means is that there is a higher incidence of either having to wear glasses to correct for that error or having to do some additional surgical treatments. If you have had one of these procedures in the past, please be sure to let us know and understand that while we do everything to provide an exceptional outcome, we cannot change the fact that your cornea has been previously altered and this could affect your results. Finally, the last thing to inform you about is that sometimes there are other conditions of the eye that are known or unknown. These other conditions may affect how well you might see after surgery. During cataract surgery, we will not correct these other conditions, which means that your vision may not improve as much as you were hoping. If you have other known conditions in your eye, such as glaucoma, retinal, or corneal disease, we will discuss these with you to the best of our ability.